Do it. Okay. All right, you ready? Okay.
Clinical pastoral education, Verbatim presentation. Motive for presentation. The aim of this verbatim is to show how I can provide emotional support and intervention to a patient devastated by the death of her two daughters and undergoing complicated grief. I have no idea how successful my intervention will be. Verbatim number 2, verbatim on patient 1. Visit number 1. Patient initials TY. Chaplain Sylvester Modibe, Unit 103. Date of admission 4th of June. Date of visit 5th of June. Length of visit 25 minutes. Gender female. Age 68. Marital status widow. Number of children 0. Social cultural identity Caucasian. Spiritual stroke value-based orienting system Catholic. Admitting diagnosis hip replacement surgery. Factual information. TY was admitted due to hip replacement. Hip replacement surgery, which can also be referred to as total hip arthroplasty, involves the removal and replacement of worn-out bone and cartilage in the hip joint with man-made prosthetic components. Hip replacement surgery is mainly carried out in order to alleviate pain and increase mobility caused by osteoarthritis, osteoarthritis. Physical therapy. Daily activity and exercise can help you regain the use of your joints and muscles. A physical therapist can recommend strengthening and mobility exercises. The therapist also can help you learn how to use a walking aid, such as walker, a cane, or crutches. As therapy goes on, you slowly increase the amount of weight you put on your leg until you are able to walk without assistance. Patient's initial concern. Patient was feeling very uncomfortable due to the pains she is getting from her hip replacement. Patient's primary concern. Patient requested the nurse to turn on the ice machine to reduce the excruciating pains, and this made her grief over the death of her two daughters. Observation. During my rounds, I visited TY in room 103. As I was about to knock on her door, I discovered the nurse was there fixing the ice machine on her, so I waited outside by the door for the nurse to finish what she was doing. After the nurse was done, I then knocked and introduced myself. I discovered my introduction was not well received by the patient, who responded squeezing her face due to severe pain from the surgery. Pastoral intention. Any surgery is always accompanied with severe pain. No matter how minute such surgery, there is pain and discomfort. There is pain and discomfort. Worse still, when such pain comes with reminiscent of grief. The pastoral intention for this visit is to provide support and attention to TY.
Does anybody have any clarifying questions?
I do have one maybe clarifying question. In the observation paragraph, I think it's your last sentence, you say you discovered my introduction was not well received by the patient. Was that because they were just in pain, or was there another reason why they were not happy to see you?
No, I think the patient was in pain.
So,
Because that was why she even requested for ice machine to be put on her.
okay,
She was in pain.
okay.
And I was also curious about your primary concern. I'm hearing two things. So the patient requested the nurse to turn on the ice machine to reduce the pain, right?
Yeah.
And then dismayed her grief over her death of her two daughters. So I was trying to understand just the kind of the connection between those two thoughts. Because the way almost the way I read it is that they put the ice machine on and it caused her to think about her daughters. Is that correct, or maybe can I have some clarity on that?
Due to the pain she was receiving, that made her to kind of remember her daughters who would have been there consoling her.
Gotcha. Okay. So because she was in so much pain physically,
Yeah.
it brought up the emotional
Emotional
pain
pain.
of loss of her daughters, because they would have otherwise been there for her.
Yeah.
Okay. Did you have this information prior to visiting with this patient that she was grieving the loss of her two daughters?
No, I didn't have the knowledge. It was during her discussion I discovered. It was then I reflected, that she was in pain, when I came in.
Okay.
Yeah.
Okay. You guys have any,
This is just a semantic, but like,
okay.
on the front cover, so where you have marital status, widow, number of children, 0, she did have daughters?
Yeah, well, they were late.
They were late? Like,
Yeah.
Two deceased daughters?
Two diseases,
Yeah.
yeah, only 2 daughters, yeah, 2 children.
okay,
And the husband too was late a long time ago.
okay.
And so you want to evaluate, your motivation for presenting is to kind of evaluate how you offered her support
Yeah,
in this complicated
situation.
situation? And to kind of evaluate your interventions and see if that was effective?
Mm.
Is that, am I hearing you correctly?
Yeah.
All right, we got enough to go on?
Think so.
Okay. All right, so we have, oh yeah, go ahead. You wanna help kind of deal out the roles and we do a visit encounter?
Who takes the role of the chaplain?
I can be chaplain.
Okay. In front of the patient.
Look at the patient.
Alright, sounds good.
I'll read the parentheses. All right, C1. The patient was groaning a little due to the severe pain from her surgery, and again, coupled with the replacement of ice machine by the nurse. The chaplain waited for the nurse to finish before he knocked and entered.
Hello, T. I am Chaplain Sylvester. I am doing my rounds. Is it a good time to visit?
The patient put up a grumpy facial expression and said,
No problem, that's fine.
You appear to be experiencing pain.
at that point, the patient adjusted herself backward.
Yes, I am. However, the ice is gradually coming down the pain.
Sorry about that.
That is fine.
What is going on in your life? What really brought you here?
I had a terrible fall at home. I missed my balance and fell. As a result, I broke my hip.
At that moment, the patient started rubbing her hip gently.
I can imagine the pain you went through when you fell.
It was terrible to say the least.
All of a sudden, the patient became emotional, and tears started rolling down her cheek, and there was silence from both sides.
I missed my 2 daughters.
What happened to your 2 daughters?
started sobbing again and then cleared her throat.
I lost my two beautiful babies to drug overdose. My first daughter died from drug overdose at the age of 30, while my last baby died at the age of 28. That would have been by my bedside offering their support.
And she started to sob again.
When did they die?
They died 2 months apart. This year made it 10 years. I lost my babies. The nature of their death was similar. They were found dead in their room.
Wow. What a devastating and traumatic experience you had.
Initially, I was very mad at God. The death of my 2 babies actually made me question God's existence.
Are you still angry with God?
I am no longer angry. I have come to terms with God.
At that moment, she decided a relief.
I really admire your,
I really admire your resilient faith. How often do you pray for your daughters?
I pray for them every day.
Have you prayed for them today?
Not yet.
Do you mind if I should pray for them?
That would be great.
At that moment, she put herself in the mood of prayer and bowed her head.
Good and gracious God, I thank you for the gift of life you bestowed upon your daughter T today. I thank you for your guidance and protection upon her. I also thank you for the gift of faith you bestowed upon her to go through her ordeals. We pray that you grant eternal life to her daughters. Amen.
Amen. Thank you so much, Chaplain.
You are welcome. I will see you some other time. Take care.
Thank you. Bye.
All right, let's take a moment, let's pause, and let's take about 5 minutes. And what are we feeling after encountering this visit?
I'm feeling some hurt and grief for this woman.
I feel like she lost her only children now, her 2 kids, and they both have the similar background of it. So it's a heavy grief with losing the 2 kids she has. Like she feels like she's just alone and having one.
Think about, or I feel the conflictual pain in this woman, for this woman, right? As somebody who wants to be empathetic, right? She's going through something very physical. And just the sheer physicality of a surgery like this. All its complications and it's all its challenges. And just living with the loss. And then there's the emotional component to it, right? And so I'm feeling that for her too, or it's almost like even though the physical pain is great, this other pain is just so much greater. I just feel that her words and her expressions are tears. also have this strong feeling for Sylvester too, and the position that a chaplain is in this situation, right? That, you know, we wanna be comforting and we wanna be helpful, but there's nothing we're gonna say that's gonna fix that pain.
Mhm.
So I almost feel that sense of helplessness
Mhm.
myself. Anybody else? All right, Sylvester, you wanna
So continue.
take it on, take it? We'll have you pause before the,
Before the chaplain?
yeah, I'll have you pause there before that.
Okay. Theological stroke, spiritual concerns. Faith is a supernatural gift which enables us to believe without doubting what God has revealed. The patient's faith was truly put to the test, though her situation was daunting. Humanly speaking, and out of frustration for the death of her two daughters, she expressed her anger at God. Job in the scripture did the same when everything he had was taken away from him. He went as far as cursing the day he was born. Job chapter 3. Like the woman with hemorrhages whom Jesus told, "Your faith has healed you." Luke chapter 8 verse 48. The patient's faith also played a vital role in her grief process. Psychological concerns. When we are separated from our beloved ones, we feel their absence. The patient undoubtedly is still battling with the emotional absence of the death of her two daughters. Thus, the excruciating pain from her hip replacement constantly reminded her of the demise of her two daughters. This feeling of grief will always be there whenever she is loathsome and in pain. How long will this feeling continue? Sociological concern. The patient appears to be living alone, away from society. Her two daughters' death due to drug overdose has a toll on her, especially when she's alone with pain. Sociological issues related to the above mentioned scenario include disenfranchised grieving, severe courtesy stigma, system failure, and severe isolation instead of just personal grieving. It is sad drug abuse is one of the major factors that leads to early death in the US.
All right, well, let's take 5 minutes. Let's let's talk about what Sylvester did well. Sylvester, he's here, but he's not here. We'll talk about him like he's left the room. You guys know the drill. I will start off by saying, I like that he knocked before I entered into the room. It's very easy, kind of very good procedural, courteous thing to do, right? Knocked. He introduced himself and even asked if this was a good time to visit. I think a lot of times that's one of the things as chaplains we have to be mindful of is like, is this the right time? So I appreciate that you did that. That's really good.
I was gonna say, I just wanted to go back and make sure. Yeah. In this particular one, Sylvester identifies like one of the bigger, I think, issues that she faithfully or spiritually identified, and that was, are you mad, or are you mad at, I'm still mad at God. Like she said, I was very mad at God. Are you still mad at God? Like that's still something, that it sounds like she could have been dealing with, and I think Sylvester did a good job of just kind of like asking that, like, I mean, are you still mad at God? Like, shouldn't you still be mad at God? So I think that's really good, like, not to shy away from that question. Cause she said it for him.
Mhm. Yeah, I think it was important that he addressed that,
Mm-hmm.
and that was, yeah, it was very important.
I like the fact that the patient was open about her situation where her two daughters passed away. And she shared that. It had to be deep. And they died 2 months apart.
That feels heavy.
Yeah. Yeah, I think it's good instincts for Sylvester in that he showed that, because if, you know, you talk about P5, C6, right, like, there's good instincts to kind of go with that.
Mm-hmm.
Because up to that point in that visit, it was mostly just about the hip, right?
Mhm.
The hip pain.
Yeah.
And as soon as she said, I miss my two daughters, Sylvester responded and, you know, engaged that.
Mhm.
And that was, I think, at the heart of what she probably really wanted to talk about.
Mm-hmm.
Especially because the chaplain entered into the room.
Mm-hmm.
I think that was this was her opportunity to let out something, right, that she was feeling deep inside.
Yeah, and again, she labels it like in P5 and in C6, like he just goes right into it, like, let's talk about it.
Mm-hmm.
I like that he asked about how often do you pray for your daughters?
Mm-hmm.
And she said that I pray for them every day. He asked, like, have you prayed for them today?
Mm-hmm.
And she said, not yet. So that's good.
Yeah, offering to be a part of that.
Mm-hmm.
I just feel overall, so it just seems very attuned to this woman in terms of just being connected to her, in her grief, in her physical pain. Yeah, just from start to finish, I just kind of feel that he's really connected with what she's presenting to him.
Mm-hmm.
Lester?
Yeah.
What did you hear from us?
I received a lot of positive outcome from the Verbatim. First of all, for asking the patient if this was the right time for me to visit. That question is very, very important, because sometimes when we visit patients, they might not be in their right mind, or they will not be disposed to that time of your visit. They might even reject you, say, "Oh, come again," of which I have had some sad experience like that. The patient not being interested, So it is good you ask that very question. Is it the right time to visit? So when they give you that positive light, then you're good to go. Again, my questioning her about being mad at God. This will make me know really if she's gradually overcoming her grief. Because naturally, when people lost their dear ones, some are indeed mad with God. They question so many things, they ask God so many questions. Why me? Why my daughter? Why not take me instead of my daughter? And so on and so forth. So my questioning her kind of resonates that faith she has, that at least she has accepted her faith. She has now at peace with God. Again, the patient, through my asking her question, relating with her on that basis, she opened up and told me her story about her daughter. Some patients are very closed up. When you go, it's as if both of you are enemies while trying to do your duty as a chaplain. They are so stone and they don't respond in a positive way. They just give you that straight answer, of which you be handicapped of asking another question. But she was so open enough to tell me her life story about what is really paining her within. And then again, the patient was experiencing I call it double barrel pain. One, her hip replacement, the pain she's getting from the hip replacement, another pain of her daughter's death. So it's a kind of double barrel pain that she was undergoing at the same time. Then me asking her the question, have you prayed for your daughters today? And she gave a positive answer. She said no, that she hadn't. Why? Then I went ahead to pray for them. And then lastly, there was a kind of great connection between both of us. And that connection gave way for her to open up to me.
Okay.
The chaplain,
No, we're gonna wait there. No, that's okay. All right, well, let's take a little bit of time here and let's maybe just kind of engage with this a little bit. The verbatim is, the visit as a whole. Where would you say you were, you said that your motive was to show how you provided emotional support and intervention to the patient who was devastated by your grief, and how successful your intervention. Where in this were you feeling that the most? Like, where in here were you feeling your motivation for presenting the most? Like, what part of the encounter?
The part of the encounter we are feeling most is that when she obliged to the fact that she's now at terms with God.
Okay.
Yeah.
Okay. So that was in, sorry,
P8.
P8.
And also, initially I was very mad with God. the death of my two babies actually made me question God's existence.
Hmm.
Yeah, in death, whenever we experience the death of our loved ones, there are certain stages you pass, and one of the stages is being admired with God and with even the dead person at times, depending on the circumstances of the death.
Mhm.
So that made me question her, are you still admired with God? Of which she willingly gave the answer that she was before, but now she has come with terms with God.
Mm.
When you come with terms with God in the process of grieving, I think that it kind of gives you that avenue to settle your grieving. You have now accepted everything with faith. So, in being in that situation, she has accepted her faith of her daughters. But being as human too, one way or the other, those pain will kind of come in, especially when she experiences this type of pain. Oh, my daughter would have been here, but then still, she has accepted it,
Mhm.
nevertheless.
Well, let me ask you something. From somebody who's lost, right? You've lost people you've loved. Could you identify with that anger that people feel towards God within yourself? Can you feel that within yourself?
Yeah, I do. When I lost my sister, which was recent, about two years ago, thereabout, I felt that great pain in me.
Mm.
Bearing in mind that before she died, we were talking on WhatsApp. I was seeing her in the hospital. She lost a lot of weight. I was really weeping while seeing her. This is not my sister. Even at a time, she herself became tired of life. One of my siblings told me that she was telling God, oh, please come and take me. I'm tired of, because she was going through dialysis, the pain, everything. It wasn't easy on her. I was really feeling it as human. That pain is there. You cannot cover it up or try to paint it to look nice. No, it should always be there, well, with blood and water. So I felt it. So when this woman was talking on it, I was kind of putting myself in her situation, how I felt some years back, But later on, I keep my terms with God,
Who helped you to get through your pain?
I would say I have a great support from the parishioners. I had great support from them. The first time she died, interestingly, that morning I was preparing for morning mass when they gave me the news. I was totally devastated that very morning.
Mm-hmm.
And I was the only one available to say the mass. If not, I would have told my colleague, my pastor, to go ahead with the mass, that I can't. But then I had to say the mass. It was really touching, I couldn't even, my voice was, I couldn't even say the name of the Father. I was kind of stammering.
Mm-hmm.
People were wondering what is happening, So it was after, during the introduction, I told them that I just received a sad news. I lost my sister this morning,
Mm-hmm.
which was afternoon Nigerian time, So the parishioners were really sympathetic. They were really empathetic towards me. So one of the ways they helped me was, some of them, they organized themselves. They said no, that I should go back. I should go and see my family back home. I told them no, it's not yet time. Though I've already booked for my flight for my vacation that very year. I told them I want to wait for my vacation time. They said, no, they have to go and see them. Of which I told them, well, I didn't prepare for that. They said, no, you shouldn't bother about that. That they will tell the pastor, they will organize themselves and raise money for me. Which is very few days. I know it's how expensive it is. Before you knew, they raised over $4,000 within a few days. So, with conjunction with my gracious pastor who agreed and everything, I was able to go home to see my family, console them as well as I console myself, you know. So that really, really helped, I must tell you. So when I came back, it's like I didn't really feel as I felt before I left. I was kind of, okay, everything has been accepted. I've accepted my faith, everything, you know. Even during her burial, when I later went back again for my vacation to bury her, I didn't really weep. I thought I will tear up during while her body is being laid on the ground, unlaid. I didn't. So I believe that first visit that came really helped me. I really cried and that was it.
Yeah.
You know.
Yeah. How long ago did she pass?
How long?
Yeah.
How old?
Or how long ago was it for you when she died?
When was it?
When was it?
Yeah, actually, I was going to 3 years now.
Okay,
I think this July will make it 3 years.
okay.
Yeah, July.
Anybody else have any?
This is just some like ponderings I had because I don't know, when I looked at sort of the difference, the things between like P8 and P9, being initially like I was very mad at God. Like I think the question I wrote right under that was, well, what then changed that to be where she is now? And so when I went down to P9, it was like I had come to terms with God. And I thought, okay, well, how does she do that? And a part of me maybe was asking myself, am I thinking those things because if I was in that same situation, I'd maybe feel uncomfortable with someone saying, well, I was angry at God. And so I'd maybe want to like redirect the conversation and say, okay, so you're no longer angry at God. What changed? To try and, like, I feel like that's what I initially want to do. But I started asking myself, well, how can I sit with her longer? And what would that look like? And so I started thinking to myself, well, what did it look like to be angry at God? What were some of the conversations you had with God? What did you tell him? Like, I don't know. Like, those were questions that started going through my head. Like, what would I want to tell God if I had experienced that same question? And so I just started asking myself, I just started writing out some of those questions on the side. And I thought, you know, that's maybe some good father for like, what could conversation you could have to maybe just sit with her a little longer before getting into so then what changed?
I think that's sometimes a very natural path to go down, for sure, right? If you're looking to kind of build that depth of connection. I think one of the things, another way to look at it is, right, as chaplains, we're always looking to be kind of rooted in the moment, right? And in the moment, right, when she says something like, I'm no longer angry and I've come to terms with God, that could be an intervention or a invitation, I think that's the word I look for. An invitation to say, where is God with you right here in this moment?
Ooh, yeah.
And I think often these are these opportunities in the moment, right? Because that's one of the things we're really always working for, right? Because that's part of the empathy, right? We do empathy lab, all this stuff together, is that presence, right, in the moment and engage. Because again, like what's happened in the past is the past, not to dismiss it, right? Future's tomorrow, we don't know what's gonna happen, but we just have right now.
Mhm.
So something to think about.
Okay.
Another thing, and like I said, I think you did a really good job, and I
Mhm.
think you work with her, you meet her emotions, right? You engage with her, you don't avoid the really difficult question of, are you still angry with God, that kind of stuff. And I think there also might be an opportunity here, really at multiple spots, but, very specifically, maybe even in this P8 to P9 sequence, you could also ask about, like, you could ask something similar to, you could ask something about, what does your support system look like,
Mhm.
right? She's lost both her daughters, and she's lost her husband, it sounds like, right?
Yeah, widow.
Yeah.
She's a widow. I don't know if you ask these questions or not, cause right, sometimes you're not able to capture everything you talked about, but yeah, like, I think there's opportunities in these moments, like, for example, like, I really admire your resilient faith, you said, how often do you pray for your daughters? You can incorporate that somewhere, but you could also have asked, I admire your resilient faith. What's made you so resilient? Do you have a support system?
Mm.
Right? Are you connected with a church? Do you have a good friend or a counselor? Just kind of explore that with her a little bit, because it sounds like she still has a lot of processing she still needs to do. So that's something you can do kind of for her in the moment, and it's just kind of help her take some inventory on what her support system is. That's something I encourage for all of you guys. Kind of part of, we went over that fact model, right?
Mhm.
Right, and when you're doing a spiritual assessment, the F is faith, right? The A is accessibility, and the C is community. And so those two things are kind of, it's all intertwined, but the idea being is that, right, with your faith, are you rooted in something, and is it accessible to you? Can you access it, engage with it,
Mhm.
can it help you? So, and sometimes sometimes it means the church, sometimes it doesn't mean the church, and sometimes it means, your family, but it seems like she's lacking in that area, so I'm just curious to know, I'd be curious to know, like, what is her, her support system, what does that look like for her?
Mhm.
Anybody else?
I always think it's really important when we offer prayer for somebody, if they've told us about something deeply personal like this, to include that if you can. I love that you wanted to pray for the daughters and include that in there. I like to, when I talk with people and they tell me about their daughters, I usually will ask, like, what was their name? And it sort of, I believe, like, empowers a little bit more into, like, or at least it incarnates who they are, so that your prayer later can be incarnational as well. So.
I will say, I'll go back to one of the things Sylvester, kind of going back to, one of the things I like, let's see here, she wrote, I lost my two beautiful babies to drug overdose, right? My first daughter died of a drug overdose, my last baby died as an overdose at age 30 and 28, they would have been, and you said, I know this is a very simple thing, you asked them, when did they die? And I think there's so often an urge to kind of not use the word die or death, right? We use terms like, she even does it, lost, or passed
Passed
away, or,
Did they pass away?
yeah, or,
Expired.
expired. It's a very clinical.
Terminated.
Okay.
Yeah, I hear it from time to time, and I'm like, guys, they died. Just,
Yeah,
they
yeah,
died.
yeah. No, I think there's something important about saying that, right?
Mhm.
You know, cause she wrestles with it, she acknowledges,
Yeah.
you're acknowledging that they died.
Mhm.
You've used the term, used the word that died. I think that's very significant. And I just, again, I would encourage you all, like,
Mhm.
don't shy away from it.
Yeah, don't be scared of it.
Don't be afraid of the use of it. I feel like it's also helps, it could be also very helpful in the patient, specifically a patient like this, like her grief process.
Mm-hmm.
So again, kudos for you.
Thank you.
This is heavy, this is a heavy one.
Yeah, oh my gosh.
It's really heavy. 3 years apart, both the drug overdoses,
Mhm.
especially considering, this must be hitting home, right, with some of the themes of the last few weeks, talking about fentanyl
Yeah,
and,
exactly.
it's very hard, hard one.
Yeah, I had a patient die, 4 weeks ago in her own apartment. She was sitting up to think that she was alive, but the whole time she was dead.
Mm.
And that's from overdose from drugs, so.
All right, well, Sylvester, do you wanna read the chaplain, portion?
The chaplain. The story of T, especially her loss of her 2 daughters due to drug overdose, resonates in me. The feeling of disenfranchised grief I suffered from when I received my vocation to the priesthood at the age of 12. Before I left home for the minor seminary, I was very close to my mom. Leaving home, I felt that gap, that hollow of motherly care and presence, especially when faced with challenges at school. During such situations, I had no one to console me or render some motherly advice. I was just on my own. Even today, here in the US, I still miss my mom. Before she passed, I always communicate with her every day, and at the end of our conversation, she always prays for me, saying, "May God continue to guide and protect you." I must confess, I truly miss those prayers of hers for me. So when the patient was voicing how much she missed her 2 daughters, I truly understood where she's coming from vis-a-vis my own experience.
All right, Sylvester, thank you.
Welcome.
Did you get what you needed from this?
Did I go?
Did you get what you needed from this?
Yeah, I did.
Okay, good. Do either of you have the CP handbook?
Not on me.
Tell me.
Handbook?
Yeah, they're open.
It's in the car.
I think I have it in my office, I just don't want it up. Again, you did a great job, I appreciate the work you're putting into it. But I do want to point out, because there is just one thing missing, and it was missing in it last time you presented, and again, there's the pastoral opportunity, okay, which comes after the chaplain. It's letter C, it's on this back page right here. Do you plan to follow up with this patient and family? What are your plans for the next visit? What did you learn from presenting this verbatim? Do you analyze the situation differently upon further reflection? So I would encourage you, I think you maybe maybe have one or two more of these, two more that you'll be doing and sharing with us. Please make sure you do that part, okay?
Okay.
Yeah, I do wanna hear about, the pastoral opportunity. This might be a little ad hoc, or a little, I don't know, put you on the spot kind of thing. But how would you feel, like, is it a patient that you would be able to follow up with?
Yeah, sure, I would like to follow up with her.
Mm-hmm.
Anyway, that would depend on her availability, because some of them, they come there, they stay a few days and they leave.
Okay.
Yeah.
So, and then this patient, did you visit with her yesterday or this week, or?
I think she has left, she's no longer there.
Okay,
That's the
all right,
problem.
okay, yeah.
Yes, most of them, they don't spend much time.
Okay.
Once they are through with their therapy, they all leave, yeah.
Okay. Yeah. So yeah, I would just encourage you, like, you know, again, like the pastoral opportunity is a really nice part of the verbatim, so I wanna make sure you capture that. You're very reflective in your writing already. It's just another opportunity to reflect a little bit more. Okay. Yeah. Okay, yeah, so it's on page 130.
Okay.
And then, that's after the chaplain portion of the chaplain, so, okay?
Okay.
All right, let's see, what time is it? Just wanna be mindful of our time. Doing okay, actually, so let's take about 10, okay? And then we'll have Coco share her verbatim with us.
All right.